The Director General of the Nigerian Center for Disease Control and Prevention, Dr. Jude Idris, on Tuesday said the agency has begun investigating and responding to a strange illness identified in 6 wards in Sokoto State. Idris said the agency has deployed a national rapid response team to work with the Sokoto State Ministry of Health to respond to the incidents. Speaking at a press conference in Abuja on Tuesday, Idris explained that the agency was notified by the State Ministry of Health on March 21st of a reported case of children presenting with symptoms which include abdominal distension due to the rapid onset of fluids in the abdomen, fever, vomiting, and weight loss from Isa local government area of the state. He noted that the most of the cases are children aged 4 to 13 years, including some adults from different wards and settlements across the local government area. He said the NSCDC deployed a national rapid response team to work with the State Ministry of Health to further investigate and respond to this incident. So far, a total of 164 suspected cases have been identified in 6 wards of Isa local government: Baragada, 22 Isa North, 17 Isa South, 98 Toza, 12 Tasbury, 4 and Turba. 11, unfortunately, 4 deaths have been recorded among the suspected cases. Now, a similar incident was previously documented in 2023, also without a definite diagnosis. Currently, 2 suspected cases are currently receiving care in Othman Danfodio University Teaching Hospital in Sokoto, and 1 case was discharged on account of improved symptoms. 4 other suspected cases are also an admission at the Isa General Hospital, while about 130 cases are also receiving care either within the primary health care centers or home care in the affected local government areas. You're welcome to Inside Today. Today we're going to be looking at the mysterious illness in Sokoto State. I am Jumai Manson. I am being joined by Mr. Akiala Isiako. He is the Director, Global Health and Infectious Disease Control Institute, Nasarawa State University, Kefi, Nasarawa State. Stay tuned. The program continues shortly. You're welcome back, and if you're just tuning in, this is Inside Today on Global Television. And like I said, we'll be looking at the mysterious outbreak in Sokoto State, and I am being joined via Zoom all the way from Lagos by Assistant Professor Akiala Isiako. He is a director, Global Health and Infectious Disease Control Institute, Nasarawa State University, Kefi, Nasarawa State. And good afternoon. You're welcome to the program, Dr. Isiako.
Good afternoon, Jumai. Thanks for having me. And good afternoon, viewers.
Thank you so much for being a part of the program. At very short notice. Thank you. I really, really appreciate. Thank you so much.
Thank you so much for having me, and thank you for the platform.
Yes, now we're looking at something very sensitive. We're looking at the mysterious outbreak that was reported in Sokoto State. Now, what is the nature of the outbreak of the affected population?
From your introduction, you have established a very broad perspective. And when you are giving us that background, I thought maybe you are a public health physician or like a public health expert. It is an outbreak of a strange disease in Sokoto State in Isa local government. 164 people were affected. So epidemiologically, you say suspected cases. But these suspected cases, we had case mortality rate, meaning that four people died from the outbreaks. Now, a postmortem analysis was done, and this it does not link to any infectious agent. From the background that you establish, you also made mention that the Nigerian Center for Disease Control, which is an organ of the government
Yes,
that
it
is
is.
saddled with the responsibility to establish outbreaks of diseases, also confirmed that these diseases, this outbreak of strange illness, has no link with any infectious agent. But Juma, let me also tell you that it has also been established that there are deposits of lead and chromium on their liver and renal kidney tissue samples.
Wow.
This also brings to bear an understanding that it is from the environment. So we have environmental pollution, we have environmental contamination that is arising from certain human activities that includes mining. So we
Okay.
saw that about 10, 15 years ago when there was a lead poisoning in Zamfara State. And you know that Zamfara and Sokoto states are neighbors. They
Yes,
share
they
the
are.
same lead belt underneath the soil. During illegal mining, most of this lead can contaminate water source. And so, epidemiologically, from a wide horizon, we are seeing that this outbreak of a strange disease might likely be as a result of environmental contamination of lead and chromium.
But look at the age gap. It says from 4 to 13 years and adults. How does that correlate when you're now talking about the lead and from mining? How does it transfer to these young persons before we get to the adults?
If you look at the landscape of Sokoto State very well, you will discover that it is found within the Sahel Savannah. And geographically, you know that Sahel Savannah, one of the challenging factors in the season we are in now is a scarcity of water. And so a lot of people tend to go in search of potable source of drinking water. If you are conversant with the northern culture, people that go around to get water are children and are teenagers. And that's why the exposure of most of these chemicals and contamination from the environment tend to mimic between the age bracket that it has been established by Nigerian Center for Disease Control. So it leads us to the water-related activities that is being carried out. I remember when we are young, we tend to go into swimming, even in stagnant water.
Very
Water that is
true.
stagnant. And so it is very, very peculiar and very common in the north that a little of water body, because of the harsh weather condition that is very hot, so those are the conversations that we are beginning to have.
Okay. All right, Dr. Akiala. Now let's talk about the symptoms that are being observed when it comes to this mysterious outbreak in Sokoto. What are the symptoms that we can point out and key symptoms that are very alarming and showing a lot of concerns at this point?
Yeah, one of the symptoms is that it comes with a of the areas too is basically associated with even the passage of blood in stool, and then difficulty in also so it if it is a lead poisoning, there are cases of dehydration because lead has a kind of a contact with the blood. I'm trying to explain in a layman's term that
But
leads
please
to
do.
dehydration. The people affected individuals tend to have a high level of dehydration. Also tends to have high cases of passing of urine, blood in urine, and also blood in stool. If you lost an electrolyte, definitely you will find out that there will be weaknesses. People will not. It's just pictorial cases of cholera where you find you pass a lot of stool. People find it very difficult to actually get into it. So there are basically weakness of the body and all what have you. You find out that also it comes with a fever. Once you pass a lot of electrolytes, you purge, you pass watery stool, it comes because you have lost electrolyte. It comes with weakness of the body and also fever. By then, you discover that people become immunocompromised, and then a lot of issues take place.
Now, Dr. Akiala, now the fear of it being contagious, how do you see it? Is it contagious? Can it pass from one person to another, or is just something that is just topically happens and then it's just one of those things?
It cannot pass from one person to another because it is not from an infectious origin. So it is not a communicable infectious disease. It is a non-communicable disease arising from an environmental contamination. So you look at the environmental toxicology part of it. But on the other side is that fecal materials that are being shedded into water sources that are also contaminated. So we can pass. In the north, the open defecation is a very common thing. So people can be able to pass this lead again from their fecal materials and then contaminate water sources. So those water sources can also be contaminated and
Exactly.
also once it is being ingested. So what you are doing now is quite key. We needed more public awareness. We needed more advocacy. We needed more people to be aware of what is really happening. And then from there, we go on and on and on and on and on. So because it is not of infectious origin, it cannot be transmitted from one person to another. But once the fecal sample contaminate water body and other people that are immunocompromised get those contaminated water, they can also cause outbreaks.
Yes, that's very true. It can also cause outbreak due to the open defecation in which you mentioned. Now, what are the preventive measures that are being taken so far, if any?
Uh, so the preventive measures is that first of all, as it's a government responsibility and other philanthropies to provide safe, portable drinking water,
Water.
and also people need to be also educated that stagnant water that has been for a long period of time should be avoided. Also needs a policy regarding illegal mining. For you to mine, you need and also use explosives and chemicals in mining. You need a license from regulatory bodies. Juma, you know that some months ago there was a blast in Ibadan in
Yes, there
Oyo
was.
State because of mining. People use a lot of chemicals to blast for mining, and then but because we have seen the recurrence of lead poisoning in Zamfara and in Sokoto State, it calls for a great concern that mining activities in those areas need to be highly regulated. And so we need to also have a government policy to checkmate that. But by and large,
Sorry, Dr. Akiala, we lost a little bit of audio there, but I'm sure it's back and better now. Now, let's look at the response of health authorities and what are the efforts that's being made to contain and investigate this outbreak?
come again, pardon?
I said, let us look at the health authorities. You know, health authorities when it comes to the health sectors, when it comes to public health and all of that. What efforts are being made to contain and investigate this mysterious outbreak in Sokoto State?
is for all other states to be at an alert. Is for all other states, neighboring states, to also key into that. Uh, uh, we need to the state government need to come up with a rapid response team. I'm so surprised that it's taking longer for them to also establish the theology of this.
Mm-hmm.
So I know that health system needs to be strengthened, referral system needs to be also optimal, from the primary healthcare down to secondary healthcare. So the reporting patterns, it took over 3 weeks for it to be established that
Mm-hmm.
it is actually an outbreak. This is because our reporting system doesn't work the way it should be. And so basically, the state minister of health should be in charge of handling most of these issues. We must not wait for NCDC to send rapid response team.
Exactly.
For them to also establish the cost of outbreaks. We need to build capacity of people at state level. We need to also build capacity of people at local government level. Jumaya, have the opinion that we need to set up a health corps marshal at our locality. Just like the way we have traditional bed attendants, we should
Mm-hmm.
be able to have people should be able to report real time health conditions, health related events, outbreaks of diseases.
Now, still talking about people being better informed when it comes to outbreak of diseases. Now, let's talk about the populace. That's the individuals who live in these various environments and spreading to other states, like you rightly mentioned. Now, how can the populace be better informed about the development of this mysterious outbreak in Sokoto State? Not minding the fact that some of these people are not literate. They are not well informed when it comes to mining. They do not understand what it means to have lens in the blood and all of these. To them, they'll feel, oh, it's just grammar this doctor is talking about. So how can they be well informed to understand the efficacy of the danger behind this mysterious outbreak in Sokoto State?
Because we have cultural inclination, we have religion inclination. Juma, we need to do stakeholders engagement. We need to do traditional rulers have to get involved in passing out this message. Faith-based organization needs to get involved in dissemination of this message. This is because they are quite stakeholders when it comes to understanding the dynamics of controls of infectious diseases. So those are the strategies that have been employed. We need to also see to how these messages can be passed down into local languages, into local dialects, let people understand. And that's why I advocated for health corps marshal. We're
Exactly.
advocating for state police, right? What
Yes,
stops
we
us
are.
from advocating for people that should be able to to report
Report.
strange diseases, infectious diseases, and all what have you in our locality? What stops us from having a dashboard where we can be able to report these diseases real time from grassroots? I know we have an existing dashboard called SOMAS that has been imported, for a German product, but that does not fit into our setting. So it's just like during COVID, we did lockdown while we needed not to do lockdown. Uh, the time for copy and paste approach has passed, and I'm looking forward to a government that will assemble Nigerians in the high tech industry to come up with health platforms where we can be able to report our infectious diseases. I spoke in Lagos this afternoon. Do you know that over 80% of our private hospitals cannot be able to report certain health related events and outbreaks into our national dashboards?
But the
So we
truth
create a
is,
dashboard.
Dr. Akiala, sorry, I want to beg to differ a bit. Do you think we have the right facilities? Looking at where we are now, most of our politicians, when it comes to the elites, they do not receive treatment in Nigeria. When they have a headache, they have to travel out of the country because we do not have these facilities. Can you actually blame these individuals?
No, no. So I agree with you that we don't have the needed facility at
At
our local
all?
level, at our primary healthcare levels to be able to manage that. And that's why I'm advocating that Tinubu government can write its legacy projects in the sands of time. We should be able to establish a state-of-the-art primary healthcare centers at our locality.
Very
Uh,
true.
just like the way we have Obamacare, If I'm Tinubu, I'll come up with a
Tinubu
health
cares.
legacy project of Tinubu Care, Jumai, and then begin to canvas for establishment of robust health system strengthening at the grassroots and at our private care level. That will go a very long way. Jumai, what also stops us from doing the brain gate idea framework strategy? If we have been talking of Japa syndrome, is it possible for us to turn the side of the mirror and then invite Nigerian medics back home, different states, and look at how they can plug in back and be able to contribute their quota to the establishment of most of the healthcare system strengthening?
But
We cannot do that until we have also private sector engagement. We saw that during COVID. Is it possible for us to strengthen private uh, maternities, private clinics, begin to see how we can be able to have seed of endowment funds for them to access funds to be able to see how they can improve healthcare service delivery and then open access to people to actually attend it. So those are the kind of conversations we must bring to the table for us to have universal health coverage.
Dr. Akiala, just to mention, not to digress, but I think to even have that proper engagement is when doctors are being treated rightly. Most doctors and nurses, when it comes to people who are in the health sector, have in quote and unquote jackpot because they feel they get better treatment, better livelihood when they travel outside, and nobody's even thinking about the well-being of those that we are left behind, or people that are left behind here, because most people want to jackpot at this point because of the better health care in which they have. But don't you think, let us start from treating these people in the health sectors, start treating them well, giving them their right dues that are given before everyone comes together and all hands on deck when it comes to a better health care in Nigeria as we speak, like you've rightly said.
Yeah, so I agree with you, Jume, but we must also do a situational analysis of where we are yesterday, where we are today, and where we intend to be tomorrow. My postulation, my submission here is that beyond the welfare of our medics, when I say medics, it goes beyond the medical doctors. Look at the nurses, look at the lab scientists, look at even community extension workers, look at the traditional bed attenders. I got a grant that I just worked on why the pregnant women will access antenatal care, but they prefer to deliver at home rather than in the hospital.
Because it's
And
not.
those are the indices. And those
Sorry,
are the
Dr.
indices.
Akiala, just to add to that, I had a research when it comes to women who prefer to give birth at home because of the high cost that it involves when giving birth in the hospital entails. So it's more cheaper and better at home. Don't you? Or do you beg to differ at this point?
I beg to differ, Jumai. So, what is the
Okay.
place of our health insurance? What is the place of our health
Is
insurance?
it
Uh,
effective? Is it
no,
effective,
so
Dr. Akiala?
those are the conversation, the national conversation and the discourse we need to bring. We need to ask the national question: our health insurance effective? Who covers for those women in the rural areas? Those are empirical evidence, research data that we need to also bring forward.
Exactly.
They would also support planning in the future. And then we did a project called the Save a Million Life. What are the gaps that we saw in those projects? What are the limitations? How can we close it? And so I did not envy the Minister of Health, Professor Patti, because he has a lot to do, because the expectations are quite high, being a technocrat and he's coming from a development sector. But he needs to do more. He needs to tell Nigerians what they need to do, and then the conversations continue. So it is a great pleasure having you around, and I hope that Global TV will go global one day and compete with CNN.
Amen, Dr. Akiela. But I'm not letting you go yet. You have a lot of questions to answer. Why are you saying it's a great pleasure having me around when I've not said you're going
Yeah,
anywhere yet? Okay, are you now the anchor of my program, Dr. Akiela?
not at all, Jumai. I will be speaking by 2:30 somewhere else, and so I needed to also engage in that forum
Oh
platform.
my God. I'm I've
Go
not had
ahead,
that
my
before.
friend.
Oh my God, this is the first. I've not heard a guess actually. Okay, okay. I'll just save that. That'll be out after the program. All right, Dr. Akiela, let's talk about this.
It's quite fun having you, having to engage with you. But I must say that I'm looking forward to see we have a program called Hospital on TV, and then we can have a
Please.
robust conversation.
Definitely. We need to bring it. We need to bring, and you're so lucky that we have a health program. Can we talk about this after the program, Dr. Akiela?
Yeah, definitely, definitely. And then we can get sponsors. We can get sponsors that should be able to fund most of these
Definitely,
programs.
definitely. We will talk about it, definitely. Now,
Okay.
over now to this mysterious outbreak in Sokoto State. Now, what are the treatment options that are made available? You know how
So
we
most of the
are,
treatment,
the African mentality
absolutely.
of self-medication. You know, when people, let me take you back, coronavirus, when people say, okay, when you have the symptoms of coronavirus, quickly take the pain relieving drug. You know, the one that starts with the P, right? The very famous
Yes,
one.
yes.
Aha.
And
So
so,
what
so,
are the
so the non
treatment options that are made available when it comes to this mysterious outbreak, Dr. Akiala?
So most of the treatment options are because people lose a lot of electrolytes. You need to rehydrate them. You need to take back fluids to them. And so just like the way we do in cases of cholera, people get infusions, or rather than what is called the oral salt solution, to actually do
That's
a fluid
ORT.
replacement. Yeah, yeah. So you have to do a lot of oral solutions replacement in an individuals that are affected. If they have other clinical conditions, it is expected that they should report to the nearby healthcare centers where they should be properly managed. Improve health seeking behavior. We need to tell people once we feel otherwise, you just need to report to a lot of health centers to be managed.
Now, with all of these medications, are there any typical side effects? Are there any that we should look out for?
There are no typical side effects. It has shown that it has been potent in terms of managing cases of lead poisoning and also chemical origins from the environment. So no side effect, except if an individual has other clinical conditions that can mimic contradictions of those medications, but it can be managed. So the management can be optimal at that level.
Okay. Now let's talk a bit about the government now, Dr. Akiala. Let's look at the response of government. Has it been swift in tackling this mysterious outbreak, in your own opinion, your point of view?
Yeah, it has not been swift. It has not been swift. If it is in other claim in advanced country like in the US, in any part of Euro, in UK, within 24 hours, you should be able to establish the cause of death. You should also be able to see to how other people can be prevented from getting those diseases. But in our claims, it took weeks and getting to months. I hope you know that this was in March, and
Yes, March.
we're 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 rounding up in April now. So it took until today we could not be able to pin down an ideological agent, being it environmental that is linked to this. So a lot of conversations need to be ignited. And then we need to also build capacity of our people.
Dr. Akiala, we actually lost you there. Dr. Akiala, are you there? Dr. Akiala, are you there?
Yeah, yes, I'm there.
Okay, I lost you a bit there, but please continue. Audio just
Yes, sir.
went off.
So we need conversation and build capacity of people around at the state level and at certain levels.
Okay. Now, looking at this, when it comes to state and local levels, basically, do you think there are much more? You said the government can do a lot of things, but as individuals, what can the individuals do? Because sometimes we do not wait for government. What can we do, individuals in those localities, what can they do to actually contain this particular mysterious outbreak before the
They should
intervention
not
of
engage.
government?
They should not engage in illegal mining. One, they should also be very conscious of the water and the food products they get from the environment. Make sure that they have access to clean and potable drinking water. Be able to hold their government leaders accountable to be able to provide these basic amenities. I'm looking forward to a conversation in a town hall meeting in my own local government where I come from, where Juma should be able to come and anchor such kind of programs to begin to tell these politicians that we need water, we need improved healthcare services, we need to strengthen our healthcare system, we need also a robust primary healthcare system that should be able to attend to certain classes of disease. Those are the kind of conversations that we have. But I'm not
Yes.
sure whether Juma has ever been in any town hall meeting for a senator or for House of Reps in our locality. So those are the conversations we should be able. Well, I can tell you that I've been part, I have known Isa local government very well in Sokoto.
Dr. Akiala, I lost you there. I lost the audio there. So I guess, are you here, Dr. Akiala? All right, we're going to quickly go on a very quick break, and then we will continue with the discuss, talking about the mysterious outbreak in Sokoto State. And I am being joined by Dr. Akiala Isiaku, who will be back shortly with me on the program. Stick around, don't go anywhere. You're welcome back, and if you're just tuning in, this is Insight Today. And today on the program, we're looking at the mysterious outbreak in Sokoto State. Now, a quick recap on the preamble of the program. Now, the Director General of the Nigerian Center for Disease Control and Prevention, Dr. Jude Idris, on Tuesday, said the agency has begun investigating and responding to a strange illness identified in 6 wards in Sokoto State. Idris said the agency has deployed a national rapid response team to work with the Sokoto State Ministry of Health to respond to the incident. Now, speaking at a press conference in Abuja on Tuesday, he explained that the agency was notified by the State Ministry of Health on March 21st, 2024, of a reported cases of children presenting with symptoms which include abdominal distension due to the rapid onset of fluids in the abdominal, fever, vomiting, and weight loss from Isa local government area of the state. Now, he noted that most of the cases are children aged 4 to 13 years, including some adults from different wards and settlements across the local government area. He said the NSCDC deployed a national rapid response team to work with the State Ministry of Health to further investigate and respond to this incident. So far, a total of 164 suspected cases have been identified in 6 wards of Isa local government: Baragaga 22, Isa North 17, Isa South 98, Toza 12, Sambri 4, and Torba 11. Now, unfortunately, 4 deaths have been recorded among the suspected cases. Now, a similar incident was previously documented in 2023, also without a definite diagnosis. Currently, 2 suspected cases are currently receiving care in Uthman Danfodio University Teaching Hospital in Sokoto, and 1 case was discharged on account of improved symptoms. Now, 4 other suspected cases are also on admission at the Isa General Hospital, while about 113 cases are also receiving care either within the primary healthcare centers or home care in the affected local government area. Now, looking at the primary health sectors in all of these things, how well do they have the infrastructure to handle these cases? And looking at the time frame, this happened 21st of March. And look at the time, we're in April right now, almost 3 weeks, according to Dr. Akiala. That is a long time for people to manage this particular mysterious infection in Sokoto State, not minding how it can spread from state to state, causing havoc in so many lives. Now, let's look at this critically. How well has the government responded in this, and how well have people been able to contain and manage this mysterious outbreak from that time till now? And that is why I will be joined by Dr. Isiaku Akiala, who will be telling us more. And he has spoken a lot when it comes to the symptoms. He has spoken a lot when it comes to treatment. He has spoken a lot when it comes to ways in which we can contain this particular mysterious outbreak. He says, let mining reduce because it's due to lead in the blood. For some people that do not understand this particular, in quotes, Turanchi English in most parts, it just means that we need a lot of people that can actually interpret this in various languages so people can understand the efficacy and the hurt this particular mysterious outbreak can cause in a community, even society, and even in a nation. Like I said, you're welcome to Insight Today, and this is the part 2 of the program. Let's quickly go on a very quick break. The program continues shortly. All right, you're welcome back to the program Insight today, talking about the mysterious outbreak in Sokoto State. And we've learned a lot from Dr. Isaku Akiala, who mentioned open defecation that happens when that could be a sure way that it can pass from, he says it cannot pass from one person to another. It's not contagious, but with open defecation and all of that, it's a likelihood. All right, now with that, we have to end the program today, Insight today, talking about the mysterious outbreak in Sokoto State. Hope you've learned a lot when it comes to the mysterious outbreak that is ongoing in Sokoto State and how to contain it, not to be afraid. It's something that with ORS, or rehydration therapy, can actually help to subdue that particular outbreak, because it has to do with diarrhea. He mentioned purging, vomiting, blood in the stool. He mentioned a lot, and of course, he actually intimated us when it comes to what this mysterious outbreak is all about. Well, I have to wrap it up on the program at about this point. Just know that learning and knowing about this is very important. It is key, and I hope that the stakeholders who are involved are listening to do the needful when it comes to this mysterious outbreak in Sokoto State. Thank you all so much for being a part of the program. I am Jumai Manzin, and many thanks to Dr. Isaku Akiala, who could not join due to one who is avoidable absence at this point. But with that, I say a big thank you to Dr. Isaku Akiala for being a part of the program. And I am Jumai Manson. Thank you all so much for listening. Bye-bye.